بسم الله الرحمن الرحيم. أعزائي طلاب المرحلة الرابعة كلية الطب جامعة ميسان، السلام عليكم ورحمة الله وبركاته. This video lecture about small and large intestine. We will take a series of lectures about small and large intestine and about the rectum and anal canal. All of these under title of lower GIT. Let us start with the anatomy and embryology of large and small intestine. The upper GIT up to the level of umbrella of water here, the second part of duodenum, is derived from the foregut. Then this part from the level of umbrella of water to the junction of medial two-thirds of the transverse colon with the distal third of the transverse colon. Up to this junction is derived from the midgut. Embryologically, it is derived from midgut. And the rest of the colon and the rectum and the anal canal, greater part of anal canal, is derived from hindgut. And according to this embryological origin, also the nerve supply and arterial supply organized. For the structure that derived from the foregut, it is supplied by vagus nerve, and its arterial supply mainly from celiac axis, while those structures that derived from midgut, their nerve supply mainly from theta, and their arterial supply mainly from superior mesenteric artery, while the structure that derived from hindgut, their nerve supply mainly from T12 to S1, while their arterial blood supply from inferior mesenteric artery. Digestion of food and absorption of nutrients occur in small intestine, while life can be sustained by total parenteral nutrition in the absence of the small intestine. Perfect growth and health depend on the normal function of this organ. The major function of the colon is reservoir and transport. It also has absorptive and endocrine function. During early life, the small intestine is located in the yolk sac of embryo. In the 10th week of life, in the 10th week of fetal life, the intestine returns into the abdominal cavity of embryo, and in so doing, it undergoes 180-degree rotation counterclockwise. A number of congenital abnormalities related to malrotation are seen in pediatric surgical practice. Regarding the surgical anatomy of small intestine, the small intestine starts at the pylorus and extends to the ileocecal valve. The length of small intestine is variable, averaging some 6 meters in length. This includes duodenum, which is equal to 25 centimeters. There is no clear anatomic boundary between the duodenum and ileum. The proximal 2/5 of the small intestine, distal to the ligaments of trees, has been arbitrarily defined as duodenum, and the distal 3/5 as ileum. This is the ligament of trees. Here it is the ligament of trees. And from here start the duodenum, and then the distal 3/5 is the ileum. The difference between the duodenum and ileum: in duodenum has only 1 to 2 vascular arcades and long and few vasa recti, while ileum has 4 to 5 vascular arcades and short and numerous vasa recti. Thick jejunum is thick wall due to circular folds of mucosa, which is called valvulae conventives or circulars, which are larger and more numerous in the jejunum than ileum. The ileum is thin wall. The mesentery of jejunum is usually transparent, while that of ileum contain fat, abundant fat. Bile patches are scanty in jejunum, while in ileum bile patches are abundant, located in the antimesenteric border. The jejunum has villi, leaf-like and more abundant. In the ileum, villi finger-like and less abundant. Approximately 40% of small bowel represent the jejunum. Distal 60% of the small bowel represent the ileum. This picture we can clearly see. This is picture for jejunum and this picture of ileum. You can see here the vascular arcades of the jejunum. It is 1 to 2 vascular arcades and long few vasoricta, while in the ileum about 4 to 5 vascular arcade and short and numerous vasoricta. Also, as I said, the wall of the jejunum is thicker and the mesentery is relatively transparent, while in the ileum it is filled with fat. Also, we can see here cut section of the jejunum, and you can see here the thick circular folds of mucosa, which is called valvulae conventives or circulars. They are larger and more numerous in the jejunum than ileum. This is ileum. The small bowel is tethered by the mesentery to the posterior abdominal wall, which carries the vascular and lymphatic supply. The mesentery travels obliquely from the left of L2 to the right of S1 joint. It is normally very mobile. The blood supply to the jejunum and ileum is via the superior mesenteric artery, which also supplies the proximal transverse column. Vascular arcade in the mesentery provide collateral supply. Venous drainage parallel the arterial supply, leading to the superior mesenteric vein, which join the splenic vein behind the pancreas to form the portal vein. Lymphatic drainage is from the bowel wall through the lacteals and then to the mesenteric lymph node, to the superior mesenteric node, and then into cisterna chyli, and finally to the thoracic duct. The innervation sympathetic supply is from T10 to T12, and parasympathetic supply is from vagus. Both pass through celiac and superior mesenteric plexus. Bowel wall contains the mesenteric plexus of Erbach that lie between the circular and longitudinal muscle coat, and also contains submucous plexus of Meissner. Sympathetic nerves are motor to sphincter and inhibitory to peristalsis, while parasympathetic nerves are inhibitory to sphincter and stimulate peristalsis. This is normal gastrointestinal tract secretion from saliva about 1000 ml per day, from gastric secretion about 1500 ml per day, intestinal secretion about 4000 ml per day, bile about 1000 ml per day, pancreas about 1500 ml per day. About surgical anatomy of large intestine. The colon is about 1.5 meter in length and is divided into cecum, ascending colon, transverse colon, descending colon, and sigmoid colon. The three important features of colon are presence of Taenia coli, The wall of the colon is composed of mucosa and submucosa, inner circular muscle layer and outer longitudinal muscle layer, which in turn is concentrated into three separate longitudinal strips called Taenia coli. Also, there are small pockets of fat-filled peritoneum called appendices epibleuicae. It is scattered all over the colon except the appendix, cecum, and rectum. The third feature of large intestine is the haustration, which are circulation between the taenia. Ileocecal valve, can see here the appendices epibleuicae, and this is the Taenia coli, and this is the haustration. The ileocecal valve here serves as a sphincter to prevent the back reflux to terminal ileum. The blood supply of the colon is derived from ileocolic, right colic, and middle colic branches of superior mesenteric vessels. The descending colon receives its blood supply from the left colic branch from the inferior mesenteric artery, but also communicate with the superior mesenteric artery, with the superior mesenteric system via the marginal branch of Dromo. Here, the marginal branch of Dromo that represent communication between superior mesenteric artery and inferior mesenteric artery. The veins run in similar distribution. Here in this picture, the blood supply of the colon, ileocolic artery, right colic artery, and middle colic artery from superior mesenteric artery, and left colic artery, not present in this picture, from